How do you prevent disease and cancer? A healthy lifestyle, and I call it the pillars of health. Leafy green vegetables, organic if possible, fruit as well. Trying to lean towards vegetarianism.
For the prevention of cancer and for the treatment of cancer, it's very important to use green vegetables, both in juices and also fruits in moderation too.
What I encourage people to do is first and foremost start juicing green vegetables, cucumber, parsley, celery, bok choy, scallions, mint leaves. Make the green juices delicious. They don't have to be boring. They are natural diuretics. They're oxygenating the body. They're alkalizing the body. This is what the body needs to do to prevent cancer, and if cancer is there, to prevent it from even growing.
We talk about the beneficial foods, organic vegetables, broccoli with indole-carbinol, sulforaphane, any of the green leafy vegetables. Soy has genistein, dadazine in it. When we look at garlic, it's a great immune stimulant. When we look at vitamin C, it can help to quadruple killer cells. So there are a variety of good things to have in the diet.
Now, in terms of diet, we differ from a lot of other doctors in that we don't just have one diet that we use. We have a variety of diets. We have 10 basic diets, ranging from pure raw foods, vegetarian, to diets where we actually allow a fair amount of animal protein. We have 90 variations of the 10 basic diets. And we're very specific in the kinds of diets we prescribe for each patient. Every protocol, every diet is individualized. So we try and assess each patient's metabolism, but there are certain ground rules that can make it simple. First, nobody should be eating white sugar. White sugar has no benefit for anybody. I mean, people have heard this before. Increasing evidence, even from the conventional medical world, is starting to question the safety of the 160 pounds of white sugar the average American takes in each year. And I don't need any, so somebody's getting my 160 pounds, and I wouldn't want to be that person. You know, 160 pounds of white sugar is like a half a pound every 2 days. It's almost like taking a drug in huge amounts. It overworks the pancreas, does all kinds of negative things. Secondly, supplementation. Again, in our office, treating cancer, preventing cancer is complicated because each protocol is individualized. However, there are certain rules that can apply to anybody. First, yes, we think vitamins, minerals, trace elements are extremely important. You know, we know that and we use them. Certain nutrients and vitamins have an anti-cancer effect. Selenium is the one that's touted most heavily. Dr. Clark, during the 1990s, did a major epidemiological study where he showed that people who have a greater intake of selenium have significantly reduced cancers. Some of the major cancer killers, like lung cancer, for example, and there's studies ongoing right now testing the preventive effect of selenium.
Other vitamins include the vitamin D, especially vitamin D3. Vitamin D3, most people, when they are diagnosed with cancer, if we drew vitamin D3 levels on them, they'd be very deficient.
Vitamin D tends to slow cell division. Well, that's important because one of the hallmarks of cancer is it tends to divide without restraint. Vitamin D directly works on the DNA through a nuclear receptor where it suppresses proliferation. It tends to shut down not normal, but only abnormal replications.
Curcumin has been shown in many studies, mostly in cell lines, in vitro, to have a significant inhibitory effect on a wide variety of cancers. They cause cancer cell apoptosis, cancer cell self-destruction. We're now very fortunate to have a myriad of natural compounds that can both directly cause cell apoptosis and also significantly improve the immune system. So, for example, poly-MVA. Another very important compound for the prevention of cancer is DIM, which is an extract from broccoli.
In our office, based on our experience and based on the scientific literature, the single most important supplement that someone can take are pancreatic enzymes. I myself take about 8 capsules 3 times a day. They're available in the health food stores as a non-prescription item.
The trend, and this is certainly the direction of the future and the direction of the present, is to use biologicals, biological response modifiers that can modify the body's own natural healing capacity. So rather than going against the body and attacking the body or attacking the cancer, we're now using the body's own internal knowledge and defenses that the body can potentially heal better than any drug that we'll ever be able to discover.
But unless we change our approach to the cancer patient, we're not going to see significant improvement.
I was diagnosed with colon cancer about 2 years ago. My lymph nodes were affected, my liver had lesions in it. They just put up their hands and say, they had written me off as dead, quite frankly. And I feel better now than I have in years.